Welcome to the International Thyroid Awareness Week webinar for 2024. Good evening, good afternoon, and good morning to our global audience logged in for the webinar today for the 16th International Thyroid Awareness Week. My name is Ashok Bhasin, and I'm the president of Thyroid Federation International. Thyroid Federation International launched World Thyroid Day May 25th in the early decade of 21st century. This has been embraced by European Thyroid Association, American Thyroid Association, Asia Oceanic Thyroid Association, and Latin America Thyroid Society, and many other endocrine societies and patient organizations concerning thyroid across the world. We also launched International Thyroid Awareness Week, which was originally launched with Merck Germany and subsequently with other partners today. I will now hand over to your host and fellow board member for the introduction to the speakers. Thank you.
Dear members, I'm Dr. Bojana Jedoksić, and I'm a board member of Thyroid Federation International. I'm honored to be your host on today's webinar, dedicated to a very important topic, thyroid diseases as non-communicable diseases. Non-communicable diseases are a group of chronic diseases not caused by infection. They result in the long-term health care consequences and create a need of a long-term therapy. Chronic non-communicable diseases are the #1 cause of death and disability in the world. NCDs are cause of death of over 41 million people a year, and they are a significant financial burden to the healthcare system. Between 2011 and 2030, NCDs are projected to cost more than $47 trillion. They dramatically affect the quality of life for patients and their families. Therefore, patient awareness, prevention, early detection, and treatment are central to effective NCDs management. Dear guests, I'm honored and I welcome you to a presentation by our guest speaker, Dr. Snežana Perišić-Živković, an expert in epidemiology, and she works at Department for Prevention and Control of Non-Communicable Diseases at Institute of Public Health from Serbia. So I welcome you, and I would like to welcome you to enjoy this presentation. And the topic of presentation is thyroid diseases are NCDs from public health perspective. Thank you. Enjoy.
My name is Snežana. I'm a medical doctor and a specialist in epidemiology. So welcome, a lot of greetings from Belgrade, sunny Belgrade, Serbia. Today, we will talk something about thyroid diseases and non-communicable diseases from public health perspective. Non-communicable diseases are also known as chronic diseases. They tend to have long duration, and also they are the result of combination of genetic, physiological, environmental, and behavioral factors. Since 2010, the main types of non-communicable disease were cardiovascular diseases, especially heart attack and stroke, cancer, chronic respiratory diseases, such as chronic obstructive pulmonary disease and asthma, and of course, diabetes. But when we talk about the burden of non-communicable diseases, we'll always talk about incidence, mortality, and prevalence of those diseases. But exactly when non-communicable diseases are the biggest contributor to death and disability worldwide. All non-communicable diseases together accounted for 74% of deaths globally in 2019. The world's biggest killer is ischemic heart disease. It is responsible for 16 of the world's total death. Since 2000 until 2019, stroke and chronic obstructive pulmonary disease were the second and the third leading cause of death. They were responsible for approximately 19 and 6% of total deaths, respectively. Something else about non-communicable diseases are well known. That is that 3/4 of global NCD deaths occur in low and middle income countries. That means that approximately 77% of all NCD deaths are in low and middle income countries. Each year, more than 15 million people die from non-communicable diseases in the age of 13 and 69 years. 85% of these premature deaths occur in low and middle income countries. NCDs are also known as a key cause of disability and have been the main driver of disability growth over the last 20 years. It is estimated that 80% of disabilities are related to non-communicable diseases. Disability is on the rise. That is the main thing with the non-communicable diseases. Heart diseases, diabetes, stroke, lung cancer, and chronic obstructive pulmonary disease are responsible for nearly 100 additional healthy life lost years in 2019. As we said, since 2010, NCD agenda has expanded from initial 4x4 viable risk factors, which are tobacco use, physical inactivity, obesity, overweight, and harmful use of alcohol, and 4 major non-communicable diseases such as we said, cardiovascular disease, cancer, diabetes, and chronic respiratory diseases. Until 2018, this agenda is broader with 5x5s. It means including air pollution as a risk factor and also chronic disease as our mental health and neurological disorder as a major disease group into non-communicable diseases. Also, the principle that is by the 2030 Sustainable Development Agenda to non-communicable diseases is leaving no one behind. It is the time to expand the NCD agenda once again and to ensure that no one is left behind. So it is the time to talk about thyroid diseases. What are they? More than 1 million people are estimated to be at the risk of thyroid disorders. Yet, these diseases are not officially included in non-communicable diseases. It means that people that are suffering from thyroid disorders or thyroid diseases face barriers across a number of fronts. The first one is inclusion and policy agenda. The second one is awareness of healthcare professional. Also, that is the main thing, is prevention of disease and complication of those diseases, access to the screening, timely diagnosis, and also timely and adequate care, data collection, research, at the least funding. Many thyroid diseases are common. They are easy treatable, but these diseases often go undiagnosed. So recognition of thyroid disorders as the part of non-communicable diseases could help to ensure better diagnosis and especially better care for those patients. Also, thyroid disorders is a global public health problem. They're especially in some ages impact well-being, such as pregnancy or childhood. Also, in advanced economy, despite decrease of prevalence of undiagnosed thyroid diseases, there is a widespread thyroid function testing and relatively low thresholds for treatment initiation. But exactly what we are talking is low and middle income countries. More studies and research are needed in those developing countries in Africa, because the key factor and the key determinant of thyroid functioning is iodine nutrition. Iodine deficiency is established in developing country in Africa. So maybe another research or studies will find the role of ethnicity and iodine nutrition fluxes in current disease treatment trends. Something that you must want to know about thyroid disease is three facts. First one is that 1 of every 20 people suffer from thyroid disease. The second is that women are at the more risk of developing thyroid diseases than men. The third is that the risk of thyroid disease increases if you are older than 50, and also if you have positive family history of thyroid disease in your family. So the fact one, why 1 in every 20 people have thyroid disease? Well, thyroid diseases are prevalent. They are prevalent because of commonly occurring causes. The reason of or conditions which can lead to thyroid disorders are commonly existing among people. So patients who don't seek for any kind of medical attention for certain diseases increase the risk factors for thyroid disease. Also, there are most common causes of thyroid disease. As we said, it's iodine deficiency, it's autoimmune diseases or disorders, it's in some cases regular intake of certain medication, and also it's pituitary gland disorders. Also, some infections can also lead to thyroid malformation. And women. Why are women at more risk of developing thyroid disease than men? According to a lot of studies, 5 to 8 times more risk are between women to develop thyroid disease than in a man. Especially that is because more than men, women has a lot of hormonal fluctuation in their different stages of life. These different stages of life are puberty, also menstrual cycle, which is every month, pregnancy, lactation, and menopause. It is something that increase a risk of thyroid malfunctioning. During puberty and of course during pregnancy and during menopause also is something that it is necessary in connection with the stress, insomnia, and anxiety, and collectively that could raise some kind of thyroid malfunctioning. And when we talk about the third fact that we want to know about thyroid diseases, it is the increased risk at older people over 50. More studies and research have found that increased risk of autoimmune diseases is with aging. So people over 50 are more likely to develop thyroid diseases. Studies have also shown that the prevalence of autoimmune thyroiditis increases at the certain person ages. So when we talk about family history of thyroid diseases are polygenetic. There is no one gene, specific gene, that has been identifying and it is responsible for thyroid disease. But anyone with the positive family history of thyroid diseases is more likely to have thyroid malfunctioning in some ages. Well, the studies also shown that 75% of thyroid diseases patients with the thyroid disease have family history of thyroid diseases in their family between mother, father, or other relatives. So we are talking about thyroid diseases, but what is thyroid gland? We called it the queen of endocrine gland, and also we called it master of controller of our metabolisms. But furthermore, the thyroid gland is the part of the endocrine system, and it produces thyroid hormones that regulate a not so metabolic rate, but also growth and development. Also, it plays the great role in controlling heart, muscle, digestive functioning, brain development, and bone mass. So, is there any place where thyroid hormone don't affect? No. First, they affect brain functioning and also our mood. On the eyes, they affect the functioning of the nerves and the muscle. Also, the vital organs such as heart and liver, it affects heart rate and functioning, and also regulates liver functioning. Also, on the other hand, it affects breathing rate. It affects the way of digestion. How? The rate of which energy is used for digestion. And also the main thing, well, for women and also for men is affect functioning of reproductive system. At last, but not at least, it affects growth and development, affecting musculoskeletal system and skin. So what are the main types of thyroid disorders? It is in malfunctioning thyroid hormones and also thyroid glands. Well, the main type of thyroid disorders are hypothyroidism and hyperthyroidism, and also well known as goiter and thyroid nodes and cancer of the thyroid gland. But when we say about hypo and hyperfunction of the thyroid gland, we talk about Hashimoto disease, we talk about grave diseases, we talk about toxic multinodular goiter. But there are a lot of things that we are talking about autoimmune diseases. 7 risk factors that are in correlation with the thyroid diseases are autoimmune diseases. Well, the first one is type 1 diabetes. The second one is lupus. The third one is rheumatoid arthritis. The fourth one is anemia. The 5th is syndrome of the Sjögren, which is autoimmune disease. And the 6th and the 7th one are primary adrenal insufficiency and Turner syndrome. What could we do when we establish that we have some kind of thyroid disease or thyroid disorder? Well, we have to be well diagnosed, and then we have to get the best healthcare treatment. It means that diagnose we can do by well-established blood tests, imaging tests, and also physical examination in coordination with our GP, and also or a specialist in endocrinology. And about the treatment, well-established treatment is at first line medication. Afterwards, some of us will need surgery and some will need radioactive iodine therapy. But there is a question, what could we do for ourselves? How could we cope with the thyroid disease? Well, it is a well-established plan, individual plan. We have to do a lot of rest. We have to find the time and make time to relax. Also, we have to find the way to keep our diary for sleeping. Also, we have to practice good sleep habits at the time when we go to sleep and at the same time when we awake. Also, we have to do several time exercises a week. We can go for a walk for about an hour with our pets or with our family members. But something that it is necessary, we have to find the way to change our behavior. Well, if we are overweight or if we are obese, we have to make our dietary changes, like cutting sweets or some kind of processed foods. But on the other hand, additionally, if we have a family history of thyroid problems, we should talk with our general practitioner, with our doctor, about our regular screening tests and also about our genetic testing. At last, but not at the least, we have to say that thyroid diseases are non-communicable diseases. Why? Thyroid diseases are chronic conditions. They require long-term management, long-term medication. They require lifestyle modification. And sometimes in our treatment, we must have our surgical treatment. Also, recognizing thyroid diseases as an important non-communicable diseases highlights the need for some kind of comprehensive approach to diagnose, to treatment, and also very good established prevention activities. Thyroid diseases affect individuals. They affect families. They affect entire healthcare system, and also they impact society and economics. So, addressing to the economic impact of thyroid diseases, it means that we have to focus on preventive measures. What are the preventive measures? The first preventive measures are primary prevention. We have to empower people to adopt healthy lifestyles and seek to timely medical attention. Secondary prevention, it means early detection and also well-established treatment, and something that it is necessary for those that are living in a family with thyroid diseases are well-established screening programs for targeting high-risk population. These are, as we said, the family with the positive anamnesis, but also there are regions, as we said, that there is a lot of iodine deficiency, and that is where well-established screening program will remote region as well as preventive activities. So this is the end, but I'm sure that, thank you for your attention, and I'm sure that thyroid diseases since next year will be the part of NCDs agenda, because thyroid diseases are non-communicable diseases.
Thank you, Dr. Snežana Perišić-Živković, for this very insightful presentation. I hope you enjoyed. And we will do this and take this opportunity to thank our sponsors and our supporters, companies Merck, Exelixis, Amgen, IPSA, Immunovant, and Iridian. Thank you all. And at the final, I will use this opportunity to invite you to the next week's webinar on the 31st of May. The link for registration you can find on Thyroid Federation International website. and see you next week.